Welcome to Young India session, and today we are going to discuss about health and diseases in today's session. Okay, now first of all, very often we keep speaking about this word health. My health is not good. You should go to a hospital if your health is not good. So we frequently keep using this word called health, right? So, what exactly is the meaning of health? Let us discuss it now. Health is a state of being well enough to function all three kinds, like physically, mentally, and socially. Right. So, health is nothing but it is a state of being well enough to function physically, mentally, and socially. So, the well being of a person can also be called as health. It is nothing but well being of an individual. Alright. Health is something that we cannot achieve just by on our own means. For example, let us say a person is very hygienic. So let us take the example of some person who is very very hygienic, in terms of food, in terms of keeping their house clean or anything. Let's suppose a person is very hygienic and he is always likely to be healthy. He always likes and always wishes to be healthy, right? So now if we consider that example of that person, then if you just observe, a person is living over here in this house. He wants to stay healthy. This person wants to stay healthy. His house is very clean and neat. It's very hygienic and he is also very hygienic. But his surroundings, no, all huge dumps of papers, all the dust landfills are near his house. These are all landfills, all the plastics, all kind of mosquitoes all come here and they stay. So what happens is, when his environment is not clean, his, or let us say, I think it's better to use the term premises or surroundings. So when his premises and surroundings are not clean, then how can he stay healthy? It's not possible. So health is something that a person cannot achieve on their own. It should be done as a community together, right? It's not that if that person wants to stay healthy, he will keep his house clean and he will keep himself very hygienic. No, that is not true. Only if the community together, if you take all together, it is conscious, it is a health conscious and self conscious, only then a person can stay healthy, or together an environment can stay healthy compared to the previous one, right? So this is how we discuss about health in everyday life and all, right? So if you consider this all is garbage, right? This all is garbage. So what if this garbage, a person is not, the municipality is not coming and it's not cleaning this garbage? What will happen? It will lie here, and therefore this person is not able to stay healthy. And not only this person, whoever are living in this community, in this area, they're not able to stay healthy. All these are affected, right, because of these garbage, right? Now, so therefore it is very important that public cleanliness is maintained in order to have a good health. That might be together, like in a community, an individual, or the whole societal level. So it is very important for public cleanliness. That is a very important aspect of health, and it should be taken care. That might be by an individual or the government as a whole, right? And to maintain a proper health, both exercise and a proper diet are very very important. Here diet does not mean the only person, like if they want to become fit they are doing diet. It is not like that. Every person, every human being, every individual should follow a nutritious diet. They should take a very nutritious diet, and they should do some or the other kind of exercise. Only then that person is said to be fit, or that person is said to be healthy. So exercise, every person does exercise some or the other. How so when you just go to school, this is your home, when you're going to the school you're walking, right? In between this distance maybe you're walking. You can tell sometimes I will go through some van, auto, or some bike, right, or cycle. So you're walking, or when you're walking or cycling you are doing the exercise. Apart from that, in case you're going to school from your home to school in a vehicle and not by walking or cycling, then you're not doing exercise. But after going to school you're writing something, right, on your book. In your book you're writing something, there you're doing exercise. You're eating, while eating your hands are moving, there also exercise is done. Of course this might not be an effective exercise, right, but this can also be considered under exercise. Now coming to diet, every individual they must follow a proper nutritious diet in order to stay healthy. So any individual it might be, they should conformly follow a proper nutritious diet in order to stay healthy and disease free. Okay, so now what is the meaning of a diet here? Basically let us consider this as your food plate. This is your food plate, and now in this food plate I'm going to divide it like this. Okay, so now this is proteins, this is carbohydrates, these are fats, these are vitamins, and these are minerals, right? So if you just see, these are proteins, carbohydrates, vitamins, fats, and minerals, right? Now your food plate or your diet should contain all these 5 components, all these 5 nutrients. All these 5 are collectively called as nutrients. This proteins, carbohydrates, vitamins, fats, minerals, so all these they are called as nutrients, and all kinds of nutrients should be present in your diet or your food plate. That is very important for you to stay healthy. All right, so if you see here children, I have taken 4 examples. I have taken 4 people as examples. So they are person A, person B, person C, and person D. Right, if you see person A, he is doing exercise properly, but he is not following a diet. So this person is not likely to stay healthy. So his 100% health is not reached. In this person, it is not there. If you see the second B person, he is not doing proper exercise, but he is following a proper diet. Then also he is not said to have 100% proper healthy and sustainable health. And if you see person C, that is the third person here, he is having a proper exercise and proper diet. So he is said to be healthy in terms of everything. Alright, if you come to the fourth one, that is D, the person D, here he is not having proper exercise, he is not having a proper diet. So this person is not at all healthy. Alright, so it is very important for any person, any living being on this earth, any human being on this earth, in order to do exercise and follow a proper diet to stay healthy. Okay, now children, let us discuss about diseases. Now let us start. Diseases. Okay, so when you have a disease, it means that the functioning of your body, it becomes worse, means it becomes bad, in other words. So you know what is meant by a disease, right? So whenever you have a disease, okay, so whenever you have a disease, the functioning of your body is there, right? That will become worse. Alright, so therefore it is very important for a person to stay disease free. And another thing that I forgot to tell you is that whenever we tell that a person is healthy, then we also mean that that particular person is disease free, means there is no problem in the functioning of his or her body. Okay, that is known as healthy. It means that the person or the individual is healthy in that case. Okay, so healthy also, disease free is also nothing but healthy, and healthy is also nothing but disease free, living disease free and having a sustainable life along with the proper health. Okay, sometimes you might have few symptoms. For example, let us say cough, cold, or maybe nausea or diarrhea or something but loose motions or anything like that. You might have few symptoms, but these symptoms might not tell you what the disease is. For example, if you have a cough, you don't know whether you have COVID or not. That is not confirmed until unless you are tested. This is not confirmed. It cannot be confirmed. So here what is important, what I'm telling you is, there are some symptoms shown whenever you have disease, but these symptoms will not tell you what disease you have, what type of disease you have, and how will that disease affect you. You can only observe the symptoms of it. Alright, so in this diseases also we have two. One is acute, other one is chronic disease. One is acute disease and the other one is chronic diseases. Okay, so now what is meant by acute? What is meant by acute? For example, you have a cough or a cold. Cough cold or a fever, let's say. Okay, these will stay maybe for 2 days, 5 days, 1 week, maximum 15 days, not more than that, right? So the diseases which do not last for very long period, that is the diseases which are there for short span of time, short period of time, those diseases can be called as acute diseases. Okay, whereas chronic diseases are nothing but they are like, for example, if you see cancer, diabetes, let's say BP, that is the BP disease you have, right? That one. Okay, so all these, they last throughout your lifetime, they last lifelong for you. I mean, not for you but for people, right? So these diseases which last for a longer period of time, that is the lifetime, then they are said to be chronic diseases. Okay, acute disease will not do a lot of damage to the body. Although it does affect the body, it does not do a lot of, or it does not have a lot of effect on the body. But whereas if you just see the chronic disease, it affects the body worstly at times. Like for example, if you have this cancer, diabetes or BP, something like that, then the body gets affected very severely due to this sometimes, right? It does happen in a few cases. So we can tell that chronic diseases have a drastic, maybe lifelong term effects on the health, right? So we can also classify diseases in another condition, like in another type also, that is the infectious diseases and the non-infectious diseases. Okay, so infectious diseases, they are also called as communicable diseases, whereas coming to non-infectious diseases, they can also be called as non-communicable. First of all, what are communicable and non-communicable diseases? Communicable diseases are those which spread from a person to another person, they spread, whereas non-communicable diseases, they do not spread from one person to other person. For example, you have viral fever. So viral fever, or let's say cough, cold, and even this COVID-19 virus, this is also communicable, etc. So these are all communicable diseases, that is they spread from one person to another person. They are infectious diseases, right? They infect from one person to another person. Coming to non-communicable diseases, for example, you have diabetes, you have cancer, etc. So all these, no, these diseases, these kinds of diseases, they do not spread from one person to another single person. So here they are not spreading, so they are known as non-communicable diseases. Okay, so communicable diseases, how they spread? Maybe through air, water, air that you breathe, the water that you consume, contact, that is if you just touch another person, that another infected person, then you might be like, there are chances that you might be affected with the disease or virus. Food that you eat, it might, like the virus might contain the food that you eat. I mean, sorry, the food that you eat might contain the virus, right? So these are all the causes for the diseases, types of diseases and the causes for diseases. And apart from that, even your environment might also add up to this. Environment will also add up to this. Okay, because environment is nothing but your surroundings or your premises, so where you live or where you are. So what happens is, when your environment is not clean and it contains the virus, then that might, there are chances that it might spread to you also, you as well, right? So there are a lot of chances. So there are various other factors also which affect, I mean, which cause the diseases and which causes the diseases to spread. Okay, so children, if you see in India, if you see in our country India, Many diseases many diseases have been eradicated. They have been eradicated. Means we don't find them anymore in India. We don't find them anymore in our country. So how was this possible? The first thing is due to vaccinations. Vaccines. If you see, for example, polio, smallpox, so these kind of thing we have brought it down. That is, we've eradicated completely from our country using vaccinations. Just by vaccinations, we have done that. And of course, there are few safety measures that we have also taken, of course. And even if you have observed during the COVID times and all, India has found, like, it has this, I mean, invented a lot of vaccinations, many medicines as well, in order to eradicate COVID-19. And we are almost at the verge of ending this COVID-19 in our country, right? So this is how we can just tell about our country as well in terms of health and diseases. And if you just come now, we have seen about the diseases, that is, it has eradicated few viruses and diseases that spread using vaccinations and all. But in in the same country India, if you just observe, in the same country India, if you just talk about the health of people, we have many hospitals in India. So the doctors per 100 in India are, doctors per 100 persons in India. I'm sorry, 1000 persons. 1000 persons are one. I think it's better to say is one. And here, doctor per 1000 persons is one. That is, for 1000 people in India, we have just one doctor. Just imagine the situation, 1000 people rushing towards a single doctor. The case in India is like that. So this means that India still has to develop. It has to increase the number of medical colleges, medical seats, and also it has to increase the number of medical practitioners also. Right, it can do by bringing awareness among people. That is, maybe everyone can be educated and everyone can be made a doctor. I mean, even the poor can be made a doctor. That can be possible when the government is taking care of that. It can surely be possible. So it is the work of the government to make sure that every person, every child is getting educated and they are able to reach their goals. And one of that is doctor, right? And for Indians, in order to stay healthy and disease free, what should be done? That is also one important aspect that we have to notice, right? What should be done? So surely the first thing that should be done is the cost of medication or the cost of providing health care. Cost of providing health care, this should decrease. Of course, maybe the government cannot provide free healthcare for each and every person, but it should be reduced till some or the other extent. That one they can manage it with other sources of the economy, right? So they according to their plan, as per their plan, they can do it. But the first thing is the cost of providing healthcare should be reduced. People should be given awareness that you should not leave any diseases just like that. You should go to a doctor. You should go for a checkup, you should have the proper treatment from a right doctor, right? So this awareness should be given to people, that is to the Indian citizens. Of course, many people do not have any idea about the healthcare, the hygienic conditions. They don't live in hygienic conditions. They all have to be given the proper awareness, the right awareness regarding this healthcare, and how you can approach a doctor when in terms of when you're in need, right? So even this cost, it should be at least minimized till some extent for the poor people, right? So this is all for today's session, children. Here we have learnt about health and diseases. What are the different, like, in order to stay healthy, you need to be a sustainable liver, that is, you need to have both a good diet and you need to follow a proper exercise schedule. Only then you can achieve the health goals. And coming to the diseases, as I told you, India has also eradicated many diseases. We have seen the different types of diseases: communicable, non-communicable, right? So these are all the important aspects, right? And if you just see here, the quality is also important. Basically, we tell that just quantity is not sufficient, quality should also be there. Quantity itself is not, it will not suffice. Even quality, proper quality of healthcare should be there. Only then we can reach the goals of uh, a good healthcare provided as a country. And if you see, people, I mean foreigners also come to India for accessing treatment for healthcare, right? So if you see in some private hospitals, they come, the first thing is, compared to their countries, the prices might be low in India, at a few places, if you just see, when compared to their countries. But if you just see in terms of our country, the citizens face a huge problem, that is the expenditure of cost in the hospital, that is for all the medication, the healthcare treatment, everything, right? So it's not about the foreigners who come for treatment in India, it's about we ourselves, we the Indians, either we are able to afford it or not. That is what is more important for us. Of course, there is a lot of medical tourism in India, that is, people come from outside countries to have a good access for healthcare in India, because they believe that India has a good number of doctors, and the doctors are very well qualified doctors, right? So it might not be possible in all cases, but if we just see, people basically consider that government hospitals are not that useful, they do not provide quality healthcare, but it is not true. We cannot judge anything just like that. If you just hear the word government, then people think that it is not correct, I mean it is not a qualitative thing. It's no quality is being provided in any government type of service, right? People just think like that whenever they just whenever the word government strikes to their mind. So that is wrong. What you need to think is whether people are given what is being required for them, whether people are being able to access whatever is required for them. That is what is more important, right? Because if you just see in government hospital also, people are able to get free healthcare services. The poorest of the poor people, no, they're able to afford they're able to get healthcare services for free, and they're happily going home disease free and healthily. And if you just consider the private hospitals in India also, of course the number of private hospitals are increasing day by day. That is one thing that is to be noted. But still, it does not mean that people in India, the government is denying the healthcare of the Indian citizens. No, that is never possible, right? And according to our constitution, if you just move that political side also, what happens is, we the Indians have freedom to oppose our politicians. I'm just talking about the political aspect, uh, right? So we the Indians, as per the Indian constitution, we have the right to oppose the politicians. It does not mean the politicians, but yeah, the government and also the rulers. Rulers here are nothing but the democratically elected rulers who is the government itself. We have got the right to oppose the government in any case, in any situation. So we also have the right to oppose the government in terms of healthcare. If the quality is not being provided, then conformly people are the one who will be protesting, and maybe next time the government won't be rising its wings. That's it, it's done. Right. So this is all about today's session. Thanks for attending today's session, children. I hope you enjoyed the session. Meet you in the next session. Thank you, children.